Okay, so apparently last time some person did, had a confusion over the term hotspot, and it was like saying pathetic, with over 300 cases Ontario-wide. Pathetic, what's up hotspot? So obviously that guy, yeah, he's confused about like the three additional regions added to the list of India hotspot India variant hotspots. So it is basically yeah. It's basically pure region. So it's basically pure region, HALTON region, Porcupine County, Toronto, Waterloo Region, WELLINGTON-DUFFERIN-GUELPH region, York Region, Hamilton, Durham Region, and SIMCOE-MUSKOKA region, which are the regions with high India variant hotspots. So pure region, Toronto and Waterloo region. These three regions. The major concern is the reason that the numbers might be high is because of the India variant affecting it. The three regions. So yeah. So it's not pathetic. It's like India variant. It's completely the molecules that's made up of it is completely different. So the UK variant, South African variant, and the Brazilian variant, the molecules of those three variants are like the same. However, the Indian double mutant variants, the molecules are sort of different, making it hard for labs to track that variant. So now, which means it's trouble. So those 10 regions can pre-book their vaccine, second vaccine shot early out of hotspot with the PFIZER BioNTech vaccine or the MODERNA vaccine. But now they also have the option of AstraZeneca vaccine and where to they would like it. So Ontario's coronavirus cases is at 355, okay, lower. So it's sort of higher than yesterday's, but it's we're improving. So Toronto's back in the high with 58 cases, again. 54 from Waterloo, still high, because they still have the highest cases, coronavirus cases out of the entire Ontario province. 45 from the Peel region, 23 from Hamilton, 22 from Porcupine County, and including Timmins, which Porcupine County sort of takes over. 18 from York Region, and 16 from Ottawa, and also 16 from Durham Region. So all other regions reported under 15. Okay. And that's for some reason there is no variant case reports today. Odd. It's not a holiday today. Which leads me to the vaccinations. So you know, you can book your vaccine. If you're 12 and up, you can pre-book your second shot for those 70 plus. And India variant HOTSPOTS. So you know, you can choose the vaccine and the location. The times vary, and depending on the first vaccination, you will need your vaccine receipt. So you have to type in when you first got your vaccine. So 18 and up can start pre-booking June 28th. So the system's really changed. So when you first book your vaccine through the website, and now it has completely changed. You know, COVID, you can do it through COVID19.ontario.ca/book vaccine by phone 1-888-999-6488. At a pharmacy, do local health units, and vaccine bookings for youth 12 to 17 can also be through youth and family clinics and just regular clinics. And youth not age 12 can book for later dates through 1-833-943-3900 or through public health units. Phase 1, 2, 3 rules are down below. The earliest, even though we have 20% of eligible adults getting their second vaccination shot, you know, it's 3 week rule. We have to like get. Three weeks. So you know, so even though like some people were trying to convince the government to let's start phase 2 earlier. No, sorry, you know, you gotta stick to the rules. Okay. Which brings me to the Ontario, so Ontarians who got the first shot of though the AstraZeneca vaccine are canceling appointments for second dose of the vaccine following new of that vaccine. So they're canceling the second AstraZeneca vaccine due to the Ontario pharmacists are associated that they said they were worried that the remaining stock of AstraZeneca vaccine could end up going to waste, despite the province maintaining that residents could still opt for that vaccine if desired. And if you actually go on the website, there's the three options for vaccines you can choose from: PFIZER BioNTech vaccine, MODERNA vaccine, and the AstraZeneca vaccine. So, CEO Justin Bates said in an interview, if people move away from the AstraZeneca vaccine, it's going to sit in the fridges because nobody wants it. There's nothing we can do with it, and I think that's a shame. And so the NACI, the National Advisory Committee of Immunization, changed its recommendation on Thursday for people who got AstraZeneca the first shot. So they said they were recommending for people who got AstraZeneca the first shot, saying it would be better if they got the PFIZER BioNTech vaccine or the Moderna vaccine, mRNA vaccines as a second dose. So they were like the NACI were like sort of like trying to convince people switch side that use to try to prefer the BioNTech vaccine or the Moderna vaccine instead of the AstraZeneca vaccine. So even though the AstraZeneca vaccine, the original wait time was 84 days. That's 12 weeks. But now they lowered it to 56 days. So that's 8 weeks. I calculated that. So Ontario said it currently has approximately 160,000 doses of the AstraZeneca vaccine available, with shots offered through pharmacies and some primary care settings. So Justin Bates said, the pharmacies will continue to offer AstraZeneca to customers who want it, though he noticed that many clients were expressing frustration over new guidance. And he said, people are confused and they're angry, and I don't blame them for being angry. Because of course they did say if you got the AstraZeneca vaccine, you can switch if you want. It's your choice. So Health Minister Christine Elliott, she mentioned you can switch to a bit different vaccine for your second shot if you want. And also location, you can switch your location too. Yeah, you could get it like a vaccination center or a pharmacy or a mobile clinic. Yeah. So she's so Christine Elliott also said to which some with Dr. Lawrence Lowe of the Pure Region, and Dr. Peter Journey have also said before that she said to ensure maximum protection against coronavirus and she had used Delta variant. Same thing. So Ontarians should get vaccinated as soon as they can and book the second vaccine shots. And India variant, the nickname Delta variant given by WHO. So yeah, it's a big threat. It's no joke. Dr. Peter Jr. has mentioned is and others and health care officials and doctors have mentioned is if you only get like partially only one shot of the coronavirus vaccine, the mRNA vaccine, the PFIZER or vaccine, or the MODERNA vaccine, or the AstraZeneca vaccine, which is not an mRNA vaccine. So you are technically at risk to getting affected by the India variant, and especially if you are in a hot spot. And let me remind you over what Pure Region, Halton Region, Porcupine County, Toronto, Waterloo Region, the SIMCOE-MUSKOKA Region, York Region, Hamilton, Durham Region. Yep. Those 10 regions are India variant hotspots. Which means that you can get, especially Pure Region and Toronto and Waterloo Region. And then not to mention Waterloo Region, which covers Kitchener, Waterloo, and Cambridge. Those three cities and towns, and four townships. Yeah. Oh, it's a tough thing. So getting fully vaccinated that's a very important thing that we need to do right now, and it's priority. because this could ruin our summer. So, hospitalization, nothing on hospitalization, So for some reason they're not reporting those but for variants and hospitalizations and ICU and ventilator cases. I have it down below from yesterday's data pool and long-term care home death. Of course, nothing on that too. So also that data pool is from yesterday's. And some numbers have not changed since last week or last month. And I'm talking about staff deaths and long-term care home deaths have not changed since last week. So please follow coronavirus safety rules and regulations and phase 1 rules. Don't have any gatherings of over 10 outside for the safety of others. If you haven't signed up for vaccinations, please do, because India variant it's the new threat. India variant, Delta variant, whatever. It's the new threat. So please sign up, and it's also phase 2. And get ready for phase 2 because which got the regions most regions will be switching to phase 2 of although it depends on what the health unit if they approve it or not. You gotta it's their decision. Stay safe.